Let me bring in Paul Seegert. He's with PCS Healthcare Advisors. They consult businesses around the country how to reduce their healthcare costs. And if healthcare were simple, we wouldn't have Paul on the show so often. But here he is today to talk about this. Paul, how are we doing?
I'm great. How are you?
I'm doing fine. I see this and go, all right, well, it's an elective procedure, right? And generally your health insurance doesn't cover elective procedures, and they go to Mexico. And, to pull back here, medical tourism, how big a business is this?
Well, it's big. And at least pre-pandemic, it was pretty big, and it's coming back, and we'll likely get back to those levels. We're probably headed back to those levels maybe this year, certainly this coming year. And just going to, and Mexico is one of the top destinations, of course, because it's close to the U.S., it's close to Canada. And they were getting about 100,000 people a month that were coming to Mexico for medical tourism, mostly elective, also complex dental procedures that oftentimes, even with insurance, you end up paying a lot out of pocket for here. And then drugs. Expensive prescriptions that you could pop across the border and get the exact same drug for a lot less.
Yeah, and a little more lax, too, as far as their control goes, because you can, if you're in the airport, if you've ever traveled to Cancun or out west, whatever it might be, and you come back through the airport, they actually sell a lot of drugs that you need a prescription for in the United States, and it's relatively cheap, things like Z-Packs and things like that.
Yeah, it's about across the board. If you look at all the medical services and drugs that people consume, it's 50 to 70% cheaper to go there. And I've actually had the chance to tour some of the facilities. We had an office in San Diego, and we had clients that for certain parts of their population would even offer benefits that included the ability to get service in Mexico, right across the border. And they have facilities that are every bit as high tech and clean and professional and all of that as we do here, specifically for this industry.
Yeah, I think, Americans, we think of it as, oh my God, you're going to go down there and it's some clapboard room and there's sawdust on the floor and there's a guy in the corner drinking tequila and giving you the stink eye. It's like, you're going to go get a medical procedure done and they're tying you off with a dirty rag or something. No, it looks like a hospital here in the United States, doesn't it?
Absolutely. Clinic. It sure does.
Yeah.
And if you could do it here for the same price, of course, people would not go, but they don't face the amount of regulation. And there's just so many areas where costs, of course, are a lot less.
I guess the way to look at it too, though, Paul, is if you go there, how many people are coming back maimed or sicker or injured? And I guess if that were the case, people wouldn't go because the word would get out. But it sounds like the outcomes are on par with what you would get here in America at a much, much greatly reduced rate.
I think that's largely true. But there's also not enough really good tracking to know there's no real accurate numbers in terms of negative outcomes or bad outcomes. There's anecdotal information. I think in this day and age with people's ability to share information on social media and so on, you can get a read on is this a good provider or not. But, they're not regulated to the same degree, of course. So these are people that are willing to accept that and accept an element of risk, certainly not the amount of risk that we're seeing in this story. But certain amount, they're willing to take a certain amount of risk because they're saving considerably. Yeah.
Well, let's look at it from this perspective. If, the Yelp reviews, let's say, and I don't know exactly where plastic surgery on Yelp, but maybe so. It's crowdsourced. The word gets out. If it's a bad practice or people are getting sick or injured, they don't know what they're doing. But if the outcomes are similar to what you get in the United States, it's significantly less cost. Isn't that an indictment of over-regulation here in America relative to medicine?
That's certainly part of it. You've got that as an issue. You have the insurance payment model that's a significant problem when you take the consumer out of too far away from the actual cost of something and just tell a vendor or a provider or a drug manufacturer that, hey, this is going to be covered by insurance very consistently, the cost goes up. And so, look at the whole COVID experience we went through. The cost of a COVID test went up dramatically as it moved from being something that was being paid for directly by the government even, and then became something that was put into an insurance plan. Cost changed. And same thing with vaccines, and same thing as compared to, the fact that we could get we had manufacturers making tests here, shipping them to Europe, selling them in a drugstore for $5.
Right.
And we're paying, $80, $100, $120 for the same thing. So that's a huge problem too, is that we've insulated the consumer from the actual cost of care.
Right.
And they only think in terms of co-pays and deductibles that often have no relation to the cost of care.
Mm-hmm.
And that just allows for, plundering, really. You can come to America, sell your thing here for 10 times what you sell it everywhere else for. I mean, it's the dream of everybody that makes anything to sell it here.
Paul Seegert, PCS Healthcare Advisors, he consults businesses on keeping their healthcare costs down. I'm talking about the 4 Americans going to Matamoros, Mexico, and 2 of them killed, 1 of them injured. The 4th is going to be okay, it looks like, or at least 2 of them are going to be okay. But went down there for medical tourism to have a procedure done, which would be cosmetic here in the United States. And the reason people travel to places like Mexico or Thailand or Canada, wherever it might, probably not Canada as much, but Thailand is a big one I know too, is because it's more affordable. And the outcomes are almost as good or close to as good here in the United States for much, much less cost. This is not we know what Mexico is, right? It's a nation that sponsors, in effect, terrorism through cartels. That's a different argument we're talking about here, and that is how jacked up the American healthcare system is, that people have to travel to Mexico to afford procedures. Now, someone may also go, Paul Seegert, well, this is just cosmetic surgery. She was going there for a tummy tuck, and this is why you shouldn't, go to Mexico for those kind of procedures. But, for some folks, and I think she has 5 or 6 kids, it could be a medical issue, excess skin and if you lose weight. Another one are breast reductions. That's looked at as cosmetic, but for a lot of women who have huge breasts, right? You get back pain, you get stenosis in your back. It's painful, and so the reduction is not cosmetic; it's medically necessary. And yet, insurance companies won't write it here or cover it here in the United States. Folks have to go to Mexico for that treatment. That's a failure of the system, isn't it?
I think so, and maybe we're the sponsors of our own cartels. I mean, I say that a little bit tongue in cheek, but we've allowed this medical industrial complex to run so wild that. And it's not all cosmetic. You have people that need crowns and root canals and bridges and implants, and they're crossing the border in large numbers as well. Yeah. And they're doing it because we've created a system where we're pricing our own people out of healthcare. We have a massive population, a massive portion of our population that are in medical debt, and most of them have insurance. Mm-hmm. Depending on who you believe, there's around 100 million Americans with medical debt. What are we doing to solve that? We're changing the credit reporting rules to kind of sweep it under the rug. We're continuing to each year watch these ACA approved plans have deductibles and max out of pockets that climb. You can have an individual max out of pocket right now over $9,000 in an approved plan by the Affordable Care Act. And how many Americans can afford that? Right. That's, of course and that's simple math. You're allowed to run that wild, and you have a $9,100 max out of pocket. And the average American, many of them don't even have a savings account. And, you kind of just set the conditions up for 100 million people to be in medical debt. Right? Yeah, it's not sustainable for individuals. It's not sustainable for employers. It's not really sustainable for our economy the way it's set up today.
It's interesting you said that it's a cartel. It is. It's controlled at the top, and I mean, look at the money that comes in as a result of this thing, and as a result, Americans have to travel abroad for healthcare. In some cases, as you mentioned, this isn't just cosmetic, because they'll sweep that, as you said, sweep it under the rug. It's like, it's cosmetic. She had it coming. No, not really. Plenty of people go to Mexico or other countries for basic procedures because they don't have insurance and can't afford it. And what does that say is if Americans, working folks, can go to Mexico, and the risk, the travel costs, all that stuff, it's still cheaper than using your own insurance, and then in some cases won't cover it. What does that say about our system? It says our system's not only broken, it's set up to fail.
We've got 14 or 15 lobbyists for every member of Congress that are fighting really hard. They wake up every day, and the race is on to keep it the way it is. And, it's really unfortunate. I think if you look at what, not too big of a change of direction, I think it ties in. I think there's some positive signs on the horizon when you look at like Eli Lilly recently just voluntarily lowering the cost of insulin. I think that's because they see the writing on the wall. The pressure is building to a point that even despite the fact that there's 14 or 15 lobbyists per member of Congress, there's a growing awareness because of people like you that are continuing to sing the song of the fact that, hey, there's things that are going on that shouldn't be.
Yeah.
There's no reason we should pay 10x what our peer countries pay for the same drugs that we developed. I mean, that's not reasonable on its face.
Yeah.
And we got to do something about it. I think they said, hey, we better voluntarily do something or we're going to end up being forced to do something we really don't want to do. And we'll give up this, semi-monopoly we have with two other companies on insulin.
Well, here's the thing, right? You have these drug companies, Eli Lilly and Merck and others, and, you think about it on their face, they develop these life-changing medications and things that you don't even think are a problem. I need thicker eyelashes. We got a drug for that. What? Right? And we'll get all these drugs, and a lot of them are, they extend our lives to the point where we're dying of things that our ancestors never would even imagine, right? Dying of old age, of Alzheimer's, dementia, and horrible diseases, but it's because we've cured pretty much everything else. And, drug companies should be celebrated, but they're not because of what you're talking about here, right? When you're talking about the price gouging that's going on and the overinflated costs. And to your point, Eli Lilly come out and say, you know what, we're going to lower the cost of insulin because we're getting killed in the court of public opinion. The lobbyists have paved the way, no problem. Congress loves it, but the American people don't. And in the court of public opinion, they're all scumbags. You talk about an industry that really has been turned on its head. In any normal situation, we'd be celebrating and kissing the butt of Big Pharma, but we don't in America because of what you described. It makes sense.
Yeah, and it's really oftentimes the ones that are vilified aren't the big problem. Have all the middle players that nobody knows exist that inflate cost, and that has to be cleaned up. I mean, there is a role for government to regulate things. It's to set rules in this case, set rules up so that a free market can perform. We need guide rails for a free market to perform. Transparency would be a wonderful start. If you run a health plan and you don't know what the drug actually cost to get purchased, and compared to what your plan is paying when someone in your health plan goes to the drugstore and picks up their prescription, that seems unreasonable. There's no way a CFO or CEO or whoever would allow that level of or that lack of transparency to exist in any other cost driver in their business. And yet this massive fifth of our economy has kind of trained them into accepting that. That's ridiculous.
Yeah. And Paul Seegert, before I let you go, and this is a problem outside our scope, but if let's say you didn't have means, would you travel to another country for a cosmetic or a medical procedure? And if so, which country would it be?
I would consider it. There's great facilities in India. There's great facilities. There are great facilities in Mexico. I wouldn't write that out. But I would keep an eye on where I'm going and what's going on with crime there. Yeah. But I think Mexico would still be on the list.
Yeah, and if you can afford Thailand, I know is a huge one too, and their medical outcomes are significantly good there. So, it's also a beautiful place to travel as well. Well, there you go. So,
you vacation and still make it out for less than you'd pay for your.
Yeah, right. You get a nice vacation out of the deal. Now, if something goes south, I think that's the other thing. If you're in Mexico and I don't know, you have a reaction to the meds or the procedure, or whatever, do they have the trauma care and do they have the systems in place there to take care of you if in the event something happens, your heart stops, let's say?
Yeah. What's your risk tolerance?
Yeah, right. Exactly. It's pretty rare, but it does happen. So, Paul Seegert, PCS Healthcare Advisors for businesses large and small, and full circle here. I think, Paul, if our system weren't this broken, I wouldn't have you on the show as much.
That's a fact.
Or you wouldn't have a job, probably. What would be there to advise? Of course, people say, well, this is why we need socialized medicines. Like, I don't
think so.
Yeah, that's not the answer.
Does not work when you know that hospitals lose money every time a Medicare or Medicaid patient shows up.
Right.
Just imagine that same hospital looking worse than the facilities we're talking about in Mexico. That's how it would be.
Yep, exactly.
They had to survive on those reimbursements. It'd be a mess.
Paul, man, all the best. Always appreciate you coming on the show.